May I come in?
Mm-hmm.
Hi, my name is Christina Batar, student nurse practitioner, and today I'll be performing your neurological exam. Before we get started, may you please verify your birthday and your name?
BM1194.
Excellent, that matches our records. Do you have any history of neurological problems?
No.
Have you been experiencing any headaches or dizziness?
No.
Any nausea or changes in your vision?
No.
Have you been having any pain?
No.
Excellent. So we're going to go ahead and test your orientation. May you please tell me what year we're in?
2023.
Who is our president?
Joe Biden.
Where are we right now?
The doctor's office.
Excellent. Thank you so much. All right. Now I'm going to go ahead and move on to testing your gait. So if you could please stand up for me. Thank you. May you please step over here and walk towards the wall. And then come back towards me. Great. So let's scoot on over this way. Next we're going to do a Romberg test, okay? So what's going to happen is I'm just going to stand right behind you for a moment. And I'm going to ask you to put your hands out to your side, and open them to here. And I'm going to hold on to you for your safety right here. Please close your eyes. We'll count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Thank you. Did you feel dizzy or like you were going to fall?
No.
All right, so right behind you is the chair. You can go ahead and have a seat. I'm going to go ahead and start testing your cranial nerves. We're going to begin with cranial nerve number 1, the olfactory nerve. Okay, so if you could please just close your eyes for me. And we're going to go ahead and take a smell of something. I'd like for you to smell this. What does that smell like?
Alcohol.
Great. Now let's move on to optic nerve number 2. We're going to go ahead and check your visual acuity. This is a smelling chart. If you could please hold it out in front of you with both hands and start reading.
ELT, FPH, OLCF, DHJBS, EPTZO, CFDHJ, LTFPH.
Okay, great. So your vision is 20/20. So what I'm going to do is test your visual fields. So if you could start by covering your left eye with your left hand, and if you could look straight into my eye. When my fingers wiggle, please say yes.
Yes. Yes.
Let's do it on the other side.
Yes. Yes.
Excellent. Now I'm going to go ahead and perform we're going to move on to cranial nerve number 3, which is your ocular motor. We're going to check for your pupillary response, and while we're at it, I'm going to do a fundoscopic exam, okay? So I'm just going to dim the lights real quickly. This here tool is an ophthalmoscope, and that's what I'll be using to perform this exam, okay? I'm going to hit these lights. Okay, so if you could just please look straight behind me, and pardon my approach. I'm just going to go ahead and take a look in here. Excellent. And now I'm going to go on to this other side. Let's go in here. All right, thank you so much. Now I'm going to go ahead and test for your pupil reactivity. Excellent. I'm going to do it on this side. So your pupils are brisk and they're equally responsive and reactive to light accommodation, okay? So that's great news. I'm going to hit the lights so we can continue with our exam. I'm going to check for cranial nerve number 4, which is the trochlear nerve, and cranial nerve number 6, which is your abducens. So we're going to go ahead and do that. If you could please take a look at this tip. Just keep your head perfectly still and follow this tool with your eyes. Excellent. Excellent. It's your abducens, and now we're checking vertical. All right. And then we're going to test the outer corners, okay? Just keep your head perfectly still. And okay, now keep looking at the tip. All right, no nystagmus noted. It's really great. Did you experience any double vision? No? All right, great. So let's go ahead and move on to trigeminal nerve number 5. Scoot over this way. We're going to go ahead and test for sensation. Please let me know if you feel equally all the way across. Yes? Excellent. So now I'm going to ask you to please clench your teeth, like your chin, and go ahead, clench for me. All right, so those are your temporal and these are your masseters, and those check out really well. Okay, so let's go ahead and move on to cranial nerve number 7. That's your facial nerve. We're going to do that by raising our eyebrows. Excellent. And now we're gonna go ahead and close your eyes really tight. And if you can open up now, thank you. Now let's do a big smile. And I would like for you to puff out your cheeks. And these are your buccinators. All right, perfect. Let's move on to cranial nerve number 8. We're gonna check for your vestibulocochlear. So I'm gonna state something in your ear, and please repeat what I say.
99. I like 5.
Thank you so much. Now we're going to move on to cranial nerve number 9, which is your glossopharyngeal nerve, cranial nerve number 10, which is your vagus, and cranial nerve number 12, which is your hypoglossal. So for this part of the exam, could you please cough for me? Thank you. Will you please state the days of the week?
Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday.
Perfect. Thank you so much. And for this next part, if you could please stick your tongue all the way out. And I would check your gag reflex, which would be intact. I was noticing that your uvula and your tongue are midline, and then there was equal symmetrical rise of the soft palate in your mouth. Now we're going to move on to the spinal nerve 11, which are your spinal accessory, cranial nerve number 11. And if you could please shrug your shoulders for me. Thank you. And then I'm going to ask you to move your head against my hand, and we'll go ahead and do that on the other side. Perfect. So, well, let's move on to reflexes. This is a reflex hammer. I'm going to ask you to stay as relaxed as you can. Hang your arm out to the side and just let all of your weight hang on me. And we're going to look for a little response here. Okay. And we're going to go over here. That was your tricep, and we're going to aim for the brachial now. Okay. And now we're going to do brachial radial. Thank you. And we're going to do the same. If you can just twist this way for me a little bit. Thank you so much. So go ahead and bring your arm all the way out to the side. Stay as relaxed as you can. All right. That's your tricep. This is the brachial. And we're going to test your brachial radial. All right. So you had +1 reflexes throughout the top. And now we're going to go ahead and check your patellar reflex. And I know you're a little long here, but if you could just try to relax as much as you can, just relax all your weight on me. I'm going to go ahead and test your patellar reflex. And we'll go to the other patella. All the way relaxed. Thank you. And we're going to head to the Achilles. Same thing, just stay all the way relaxed, as relaxed as you can. All right. And we'll go to this other Achilles. Perfect. So, in your patellas, you had a +1 reflex, and in the Achilles, you had +2. So let's go ahead and move on to muscle strength. If you please put your arms up like a chicken wing. A little closer, right in front of you. I'm going to push down, and if you could resist me. Excellent. Put them in front of you. Can you see? If you could just pull, and not resist my push. Perfect. And I'm going to go ahead and move down to the bottom, and if you could just push against me. And I'm going to pull, if you could pull against me. I'm also going to ask you to do the gas pedal and push down, and then if you could push up, and we're going to do your toes. Perfect. So for the next test, I'm going to have to test cerebellar function. If you could please point to your nose with your finger, touch my finger, to your nose, to my finger, to your nose, to my finger. Now with the other side, please. Excellent. Yep, to your nose, to my finger, to your nose, to my finger, to your nose, to my finger. And last but not least, we're going to perform the pronator drift. So if you could please put your hands out in front of you like you're holding a box of pizza, just like you're lifting it. Yep, perfect. And we're going to hold for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. How are you feeling?
Good.
Did you feel any dizziness or any discomfort throughout? Okay, excellent. Well, this concludes our neurological exam. Thank you.